India and Nagaland second highest ase kushe HIV positive case thagedu aro Mikey Khan ge HIV positive case thagedu sabse highest ase kushe aro Nagaland bitori Dimapur district te HIV or AIDS positive cases to sabse bishi ase kushe Dimapur district nimide bhal health care service dikina HIV or AIDS aro alak bimar control prevent aro hatabule karne aje integrated health campaign do launch kushe DC office Dimapur de
itu in comprehensive service package ko bode to kali HIV laga camp health camp ase ko le kun bi nahi bo to itu pra mon services to alak offer kore ase HIV testing ekla na hoy gene syphilis TB malaria iniana alak testing kuribo mon to itu opor TB khali malaria TB syphilis ekla na hoy gene hepatitis bi thakibo de hepatitis testing B and CB bisi high ase monla state to bi thakibo aro non communicable disease kwato diabetes hypertension kwato itu BP na BP high BP laga aro anemia to ele khun kumti hoi jai na itu laga aro dosra local needs hisabte services to offer korobla ase so prevent korobol kanme mon ekla department bi na para hoi jai na itu pramohan to services to hospital khante di ase to holibi PHC CHC niga khante bi sob center ase holibi itu ekla prabi na pare itu pra NGOs kan la help loy mon laga NSEX kwala nichite NGOs bishi ase itu khambra kun drugs inject kura khan noilibi female sex workers na iniga kura khan high risk population khan lote reach out kurule mon NGOs kan ke bi engage kore mon paratak to language alak te bi common means local dialect te bi translate kurine hospital khan noile bi busti han te mon bi to distribute kore ase aru hospital khan te bi ki service dibo ki hoile test kurbo nije ke jani bole na inia translation bi ase aru mon outreach activity koide itu link workers kan inika alak pra busti de tahan kiba program khan thakili bi na Hornbill ti holibi mon la stall hodai thake aro any other public activity thakile mon tate mon advertise kore test kuri nijo la status janibi ni na it one IEC koi to ke information education communication that is a very important win of our department.
So ma'am, lastly ekta question do apuni kan inika integrated health campaign kan to thake ase holibi pusti interior de house to house jabuli la campaign kan bi kurina no kuri ma'am
itu kwase outreach workers link workers scheme koine thake de itu han duele moi supposing tai adona to drugs inject kore na to tai sati thakibo to tai la group thakibo to na itu behavior hisabte moi tai la busti te ekje manu ke choose koribo NGO pra na to tai ke tahan lote jaine convince kurla aine testing koribi aro drugs inject korili bi needle iki na cholaibi inigana like those kind of things are going on holistic ma to ite bi si high ase and we have a lot of work to do and we hope that everybody will cooperate with us the media especially.
Thank you. Campaign to doorstep campaign holis nikina
doorstep na hoy itu to ele kwan is na mon la project director pra kwan na surgical strike kwa tu ini for example railway gate ko bi kumba jaga NGOs khan to kam kore jane kun jaga te ki manu khan jama hoy na female sex workers holi bi thake noile bi drugs khan kora khan bi thake dia alak aro highway khan de truckers khan thake to truckers khan bi tami bishi high risk lifestyle ase de because gor pra moina bhar thaki jai to itu hala hotspot koi tan rukha laga jaga thake to itu hotspot khan de jabole ase not doorstep to doorstep but there are some hotspot selected site which we have already selected and it is going to be like a surgical strike I said.
Nagaland AIDS Control Society NSEX itu Delhi under Health and Family Welfare NECO National AIDS Control Organization niche de kaam kore itu regular monitoring kore aru itu NECO to certain timeline target fix kori gene itu target kan ke achieve kori bole mokan activities kan chuli phane so itia NACP 5 kori gene itia latest ekta program thaka itu program to the year 25-26 te AIDS HIV AIDS related manu इतु करने बीमार हुआ इतु करने मरी जा इतु 80% टू इतु reduce करे बोले टारगेट करी के मोहन चुरी आसे so based on that in the same line एकता 95 करी के एकता टारगेट उलाई दी इतु सब स्टेट इंडिया द सब स्टेट इतु achieve करे बोले मोहन इंडिया इतु करने काम करे आसे और 95 96 to India punja ase so itu noha itu time na punja age de itu target achieve koribole so aji program bi itu laga line te hai kori ase 95 to matlab ki ta laga meaning ki ase bole Wakhan state te all over India aru Nagaland in particular hai jiman manu itu HIV AIDS बीमार itu HIV AIDS virus tu takkan ke affect kori ke ase takkan ke jonai di bole takkan la status takkan bole takkan HIV AIDS virus takkan bole ase itu takkan la status takkan ke jonai di bole itu number 1 target ko ase so number second 95 and third 95 to directly hinge to first 95 के main बातें बड़ा शुरू करेंगे ताकि status जना पासवर्ड ताकि के आजकल तो AIDS बीमार तो दवाई आई जैसे मकान रोते भी so itu दवाई खाई जाए normal life भी पूरा पड़े so itu treatment dah hari di boleh itu target second target 95 third 95 to जिमान मनु population ते जिमान मनु HIV AIDS positive आसे इतु दवाई खास शुरू कर दिगो इतु दवाई खास शुरू कर दिले ताकन लगा गांव ते HIV virus to पहला नंबर viral load sorry ताकन लगा इतु zit suppress ते control ते रख दिगो ले इतु third target ते so मोहन नागालैंड ते Dimapur district especially जैसे patient load बेसी आसे पूरा नागालैंड है highest patient load to मोहन Dimapur district है तो करने मोहन इंडिया Dimapur में focus कर रहे हैं
we know that with medical advancement early detection in pregnant women can prevent the baby from having born with that disease so that's very important it goes a long way in preventing at least one extra in addition to that and then early treatment we know that nowadays even the people are able to live to a certain extent a very good and well-rounded life with treatments. So that kind that intervention is only possible when they are detected early and then it can help in prevention. So these kind of camps will go a long way and it's sort of like a last mile connectivity in providing services when we talk about providing services today. So this kind of health games, integrated health games is our way of last mile connectivity so that we are going out and reaching out and then screening especially the high risk groups. We have already emphasized a lot, sir have already emphasized and everyone has emphasized a lot on the stigma associated with especially HIV and that can't be emphasized more. It has to be emphasized more because that is one of the big reasons why some people will tend to hide because of the stigma and that again might lead to even more people not coming forward for screening also and then so in that case our society also needs to our media and also our society needs to play a big role in trying to reduce the stigma associated with the HIV positive cases and also and also to highlight how people can live normal lives and it is just like any other disease that we have nowadays and people can live normal lives. We see, I'm sure everyone of us knows at least a couple of people who are leading perfectly good lives even after being diagnosed with this disease. So that is our role as a government and also as a society to try and reduce the stigma associated with the HIV positive cases. And I think I'd like to point out like one of the thing with comprehensive package that is being provided. Not only will it go a long way in anonymity, but also in terms of, we know that non-communicable disease is one of the biggest killers when it comes to death rates, when we talk about diabetes, these are the silent killers of our society. So it is a very good step in achieving our SDG goals also of good health and well-being, because many of us, because all these are dependent on early detection and screening, and our lifestyle changes. So this is not just, the program is not only going to be beneficial in the HIV/AIDS prevention and reduction program itself, but also in trying to reduce the incidence of the non-communicable diseases and its screening, and how to change our lifestyle in order to prevent such things. So, like I've already emphasized before, I think this is a group effort. It's a convergent program. We have a lot of key players, and especially the NGOs who are on the field are going to do the main job, but we need the help of the public, and especially our civil societies, for people also to come forward, and also to, so this program is not going to be successful if all those come together. So that is again, lastly, I'm just reiterating that from on behalf, and we know that with the health department, we always work in cooperation. It's one of the most active departments, and we really appreciate the medical department and the different various programs under it. They are always quite active, and we appreciate. And despite our very limited sometimes resources and infrastructures, they are trying their best to reach out with their services, and so we will together go hand in hand in trying to move towards healthier society, and also healthy body,